Good afternoon. Today I've been asked to talk about or discuss with you the various types of teats that are available in relation to the breastfed baby, where a breastfed baby is using a bottle and teat. My encouragement would be to start using a cup, but because these items are available on the market, I like to talk about how they function inside the oral cavity and how, when they are used, the temptation is to gravity feed the baby. So I talk about simulation in as much as we're simulating when we bottle feed a baby with a teat in the mouth, we're simulating the way in which the breast would let down, so how the milk would flow intermittently, how the baby would stimulate to get the hormones up first, and then the transition is back from teat to breast is much easier because the baby doesn't expect to be gravity fed immediately. But because there's a whole range of teats on the market and each one has a different function in the oral cavity, it's a fixed item. It's hard, it's silicone, so the baby has to adapt. Tongue muscle, cheek muscles, vacuum, everything has to adapt to each individual piece of apparatus that goes in the baby's mouth. And that includes dummies and nipple shields as well. So my aim is to try and explain as best I can, because it's such a common question: what sort of teat do I use? What sort of bottle do I buy? What sort of nipple shield do I buy? How do I use these things? So I get asked these questions all the time. So I'm going to try and explain it in the best possible way. So the teats that I suggest avoiding are the wide base. Now, I'm not sure whether you can see this. We need a black background to see it on, I think. The wide base, or a dark background, I don't know whether you can see that. The wide base at the bottom and the short nipple on top. So let me show you with my finger that there's a gap between the straight part of my finger from here to here. There's a gap, so the baby can't seal that properly. So the gums tend to bite on any wide base teat here because they can't draw it right back and create the length that's required, and the length that's required is almost to the second joint on the mother's little finger. That's for the newborn and the young baby. So the babies can't actually get all the way back here to use the full length of their tongue. So they tend to use, well, they don't tend to, they actually use their anterior tongue. So just the first part of the tongue, the gums bite here and they pump with the gums. Then they get conditioned to using the anterior tongue in the mouth and thrusting that into the roof of the mouth. And that's on any short piece of apparatus. And it can't mould to fit the oral cavity, so the baby has to adapt to it. There's no way out of it. And then what happens is the baby becomes conditioned to that, and then when it comes time to breastfeed, the baby is using the anterior tongue on the nipple, and it's not vacuuming because it's not been used to using the vacuum pads back here to draw all the way back to the soft palatal cleft. The only as far as it can go is to the first, up into the roof of the mouth, and you hear the baby clicking. You hear those clicking sounds, and the clicking sounds when the seal breaks. And when the seal breaks, there's this gap between here and here. And whereas the breast moulds to fit perfectly. So the breast fits along the upper surface of the tongue and then moulds to fit the baby's roof of mouth right up to the lips, right where the lips seal. So the baby's actually using the oral cavity to full potential, whereas with teats, the baby can't use the oral cavity to full potential. And as you can see, there's a whole range on the market, and it's really hard to know what to buy. This has got a flat tip here, so what the baby does is use the anterior tongue, bites here, and then flicks up against here. Cannot get anywhere near the length that's required. And just to show you, there's not a perfect teat on the market, and this is certainly not perfect, but it's one that's a wee bit longer with no gap, so that actually sits on the surface of the tongue, but it needs to be longer to be able to use the oral cavity, not to full potential, but to better than the rest of what's there. So if you can get that style of teat, I don't know whether you can see that. Can you see that? If I bring it closer, that's better. Look at that. And it's not necessarily that teat, it's that design where there's no gap here, so it sits on the upper surface of the tongue. It cannot mould to fit the roof of the mouth. So the baby has to adapt to this too. And we'll use a whole different function on working this hard silicone teat in the oral cavity. That's why I say if you can cup feed, it's much better because the baby doesn't get conditioned to that sort of thing. And it depends on the circumstances. And also you will always know what's right. So if I give you the information, you make the choices and you make the decisions for your baby, which is most important. Same with dummies, exactly the same. This has got a flattish, it's not long enough, it's flat, and so what happens is the baby has that on it all the time. The round ones, they say are better because it keeps the tongue further down, but the baby rubs on the bottom of that. So then they come back and do that. And if they're conditioned on it long enough, they come back and do that on your breast. And this is just one more flat. I've seen many nipples that shape in my practice, many nipples. And when you point it out to the mother, they actually get it. The baby can get lips up to here, which is the plastic lid on the narrow bottle, which has got a narrow neck screw lid bottle. These have a wide neck screw lid bottle to accommodate that width of that teat. Babies can get up to here, but they still have to adapt to this. But it's got a small gap there between here and here, but not as prominent as the gap between here and here. I hope that makes sense. Now, if I was suggesting that you use a teat, you would buy probably the cheapest, the longest, the most simplest teat on the market, and they go back for generations. They've been around for years. And what happens then is to simulate what the baby would do so that the baby can transition back to breast is important to try and create the baby to use the stimulation of hormone production on the teat. So it practices and gets used to doing that. So when it comes to your breast, when your little baby comes to your breast, he or she actually will transition back much easier. And if you have to go back to the bottle, it will transition back again. But, minimising those things gradually and simply depending on your individual circumstances. There's no one way for everybody and there's no one absolutely right way, but my suggestion is to sit the baby up at right angles, and when you sit the baby up at right angles and you place the teat at the lips just nice and straight, the bottle's out here, and you place it at the lips, and then you wait for the baby to locate that, so the baby gets used to locating it, using his or her skills to locate the end of the nipple, the end of the teat. And then when they do that, you can gradually help just to get the vacuum started. So you just very gently help to get the vacuum started, but you're not giving any milk, and you're not actually feeding milk. The milk's back in the bottle, and if you overfill the bottle, the teat will fill, and you defeat the purpose of simulation. So it's making enough in the bottle so it just doesn't come into the teat while the baby's stimulating. You can control the flow by the gravity as the baby gets a let down and then comes back and has another episode of stimulation and gets another let down. The volume in the bottle gradually diminishes, so you can control that. So let's start back here where the baby's now drawing the teat into the mouth, back as far as it'll go. It won't go as far as we'd like it to go, but we accept that. And then we just let the baby stimulate several episodes. So stimulation looks a little bit like this. It varies from baby to baby, but it's a bit like working, stimulating, and then stopping because the milk's not coming, and then stimulating and then stopping. And when the baby's done that about 3 or 4 times, maybe on the breast as an example, not necessarily that many times, but this is just giving you a picture in your mind, the hormones are rising in the bloodstream. So the baby's stimulating the pituitary gland. The pituitary gland's releasing prolactin and oxytocin into the mother's bloodstream, and then the milk starts to come down the ductal networks. It's released and comes down the ductal networks. And as it comes down the ductal networks, when you in your mind think your baby's done enough stimulating, you think, you're making the decisions with your baby, then you tilt them both together, gently back, against your body or on your arm, so that you're not altering the bottle or the teat. You're just tilting them together on the angle so the baby gets a soft, reasonable letdown, not too fast, not too full on, and just gently. The baby gets a milk flow from the end of the teat, and then you'll see the baby change from stimulating to draw, swallow, draw, swallow. And it's the same principle that you see on the breast when the milk comes down and the baby stimulated the milk to flow. The hormones are high, milk's flowing, the baby changes the action of the jaw, and you can hear the swallowing as well. And the milk is then flowing over the back of the throat when you hear the baby swallowing, and at the same time the baby's creating the rhythm to draw, swallow and breathe. If the milk's pouring forward too fast in the mouth, the baby can't coordinate that rhythm, so they get agitated, they get stressed, and they sometimes pull away because it's all coming too fast, because they need to have a rhythm that they establish themselves in harmony with the draw, swallow and breathe reflexes. So they can do that very well if we just go gently. And of course, as the milk volume reduces in the bottle, as the baby's had several milk flows, several lots of stimulation and several lots of milk flows, obviously you'll have to tilt the bottle a little bit further. And then when the baby reaches satisfaction on that, that means the baby's, it shows behaviours that the stomach is feeling, so it starts to slow down, gets a little bit sleepy maybe, or gets very quiet, and that means the stomach has reached capacity. Stomach's about the size of the closed fist, so that gives you just a little picture in your mind that you'll know that your baby's just getting to the stage where stomach capacity is being reached. So then you just go very gently and watch the baby, and then the baby may just continue stimulating for a little while before it actually needs to come off the teat. So you can help the baby off very gently, or the baby may, move the teat from its mouth itself. One of the important things when the teat's in the mouth, if you see the teat being thrust in, the bottle being thrust forward and the teat being thrust forward, that's the tongue trying to work the teat. So it's very important that you keep the teat well in along the tongue, because if that behaviour continues, that will happen on your nipple as well. So just keep the little lips firm up against the plastic, not tight so it hurts or anything like that, but just there, the same as it would be just on your breast. And just then, create the rhythm that you would see with breastfeeding. That's the most important thing. It's about simulating, creating, and then when the baby's stomach is full, have time for the milk in the stomach to pre-digest before it moves into the intestine. So that means gently, lying your baby on your knee till it's stretched out so that it can stretch the upper body so that there's space between the stomach and the diaphragm, and then that will let the air rise. It will also give the stomach time to pre-digest that milk, break it down, and then transfer it into the intestine pre-digested, which then means the intestine is calm. It's not going to be overloaded, and it's not going to be happening too fast where the baby gets really windy and upset. Everything's calm, gentle and simulating. So a bottle feed will take almost as long as a breastfeed if you simulate and if you do it under those circumstances, and it is much easier over my experience with women and their babies to transition back to breast if we try the simulation. And to me it makes sense, but the only thing is that the oral cavity cannot do exactly the same as it would on your soft, pliable breast tissue. So I hope those little explanations help you understand that there's no need to buy expensive bottles and teats. Try to avoid the wide bottles and the wide necks. I know they look good, I know they're expensive, but you get better benefits if you want to breastfeed your baby if you use the longest possible teat you can get that has not much shape to it at all, that the baby can bring the lips right up to almost the teat, depending on the length of the baby's jaw, but the baby will work that out. The baby draws it and really important for the baby not to thrust it in and out so it's moving in the mouth. Thank you.